I'd like to call up our panelist, Onondaga County Sheriff Gene Conway, Syracuse Police Chief Frank Fowler, Assistant District Attorney and Narcotics Bureau Chief Mike Ferrante, and Jason Casanova, who is the Assistant Director of Operations for NAVAC and is also a paramedic. You'll know there is about 80 years of experience coming up to this panel. So the first question I'm going to direct to everyone on the panel. Why are we seeing the problems with heroin now, and when did the crisis start? I'll start with the sheriff.
Thank you. Thanks for giving me the easiest question to start with. Appreciate that. As far as a crisis with heroin, heroin has been in our community for many, many years. I've had almost 40 years of experience in law enforcement. At the beginning of my career, back in the 70s, for a period of time, I was actually assigned to a drug investigation unit. And heroin was here in our community back then in the 70s, and I'm sure that it was here even before that. The second part of the question is, when did it become a crisis? I think since heroin has, quote, reemerged and has become so inexpensive and so available is what I believe is driving the crisis right now. And as I'm sure everyone in this room knows, it's not a crisis here in Syracuse or in New York State. It's a crisis across our country. And so heroin is killing people here in the Syracuse community, and it's killing people throughout the country as well.
Chief, do you want to?
Sure. To answer the same question?
Sure.
Okay, which way am I going? That's me?
Yeah, I'll take it.
As you can see by the slide, our enforcement efforts here in the city of Syracuse, and as the sheriff has said, heroin has always been around. I worked 8.5 years in narcotics. Mike Ferrante was around. Congressman Katko was around. Barry Weiss was around. And way back then, crack cocaine was the main drug, but heroin was still around. And then, as the Dr. Gupta had explained, with the prescription medication, people get hooked on those, and then they advance to using heroin. And as you could tell by the slides, how the arrest and the possession keeps going up and up and up. And in fact, today, just this morning, in the wee hours of the morning, our Special Investigation Division did a search warrant on Till Avenue in the city of Syracuse, and they recovered from there 45 grams of heroin, a loaded 38 revolver, and an AK-47 type of weapon. So not only are there more drugs out there, but people are arming themselves to protect their criminal enterprises, because it's an issue of supply and demand, and the drug dealers are making a lot of money off of other people's pain.
Mike, go ahead.
Yeah, I've been prosecuting drug cases for 23 years. I worked with the chief when he was undercover. And as he said, it's been going up and up, as you can see on the chart. And that's just the Syracuse Police Department. That doesn't include the task force that we work with, the Sheriff's Department that we also work with. The reason why I think it's going up, and it's always been around, it's cheaper. And if people get addicted to the opiate pills, you know, if you run out of your prescription or your supply dries up, now you go on the street and you try to buy the opiate pills, they're $20 to $40 a piece. You can get a bag of heroin anywhere from $5 to $10. So, and they're smaller packaging than cocaine, so it's easier for the dealers to carry them around and drop them off, and we're seeing even dealers moving out in the suburbs. It's not just a city problem, it's a countywide problem. And as the chief alluded to, it is very financially lucrative for the dealers, and it's cheaper for the people that are using to get it. And I think those two combinations merged just perfectly to create the problem that we have now.
Jason?
Again, just to echo on the other panelists here, where they were talking about, it's not just in the city. I represent NAVAC Ambulance. We cover Cicero and North Syracuse School District, so the northern portion of the county. And over the last 2 years alone, it's just been a steady incline on the amount of overdoses that we've been doing, the amount of Narcan that we've been going through. Myself, as well as a lot of my crews, we speak with the patients on the way into the hospital and try and figure out how they got to where they're at. The most common answer that we get is, I sustained an injury and I was given pain medication. The doctor stopped prescribing it to me, so now I can get my heroin. And it's a global problem. And what I want to take out of this tonight is, what can I bring back to my agency that we can start putting out to the patients when we first have contact with them.
Where are we seeing these cases? All over or specific spots? And I'll open to anybody on the panel.
All over. It's in every town, it's in every village, it's in the city, it's all throughout Onondaga County. And so probably sadly, many of the people here in the room probably know of someone in your own neighborhood who has died as a result of a heroin overdose. And it is not confined to our youth. We have middle-aged people and older dying from heroin overdoses. We know from the medical people that while people believe that they're injecting heroin, many times it's something either in addition to heroin or something other than heroin. But it is truly throughout our county, wherever you live.
Chief, if you want to jump in at all.
No, actually, that's true. And one of the things that we experience here in the city of Syracuse is that people come from urban or rural America and into the city of Syracuse to purchase the drugs, and they use the drugs right there. They can't wait. They use it right there, and then once they use the drug, then they start to panic because they decide that they're in a foreign neighborhood, and then they try to drive back to their neighborhoods where they come from under the influence. And in doing so, along the way, they put everyone that they pass in harm's way because they're driving under the influence. And this drug is destroying families. We had one case in the city. A mother on the west side, her daughter comes in to find her adult daughter comes in to find her passed out on the floor. She had overdosed with heroin. The paramedics show up, they bring her back around, take her up to the hospital. She's up at Upstate, and she's waiting to get a room, and she's in the hallway, and she leaves the hospital. She takes right off. Our officers come to the hospital looking for her, and they can't find her. Then 2 hours later, we get a call for an overdose at the same address, but only this time the person is outside in the vehicle. Well, she wasn't so fortunate that time around. On the same day, within a 4-hour period, she had overdosed twice, and the second time she died. And the first time, her daughter and her granddaughter witnessed her laying on the floor.
Mike, what about the punishments if someone is arrested for possession?
Well, simple possession is just a misdemeanor unless you can get it up to a specific weight charge, which would make it a felony. So for a misdemeanor, if you go to jail, the maximum would be a year at Jamesville. If you are possessing it with the intent to sell it or actually selling it, again, depending on the weight, you could receive a state prison sentence. For your first offender, you don't necessarily have to go to state prison at all. You can get a local sentence or probation or a conditional discharge, whatever the judge feels like giving you based on your background. If you have a prior nonviolent felony, then it's a mandatory state prison between 2 and 12 years. And if you have a violent, it's between 6 and 15 years, again, mandatory state prison. There are some A-level felonies, again, for sale of a half ounce or more, or possession of 4 ounces or more. Possession of 4 ounces of heroin is very hard to come by because it's so fine. But again, those increase anywhere from 3 to 10 up to 8 to 17. And then if you sell 2 ounces or more, and again, that's a large amount for heroin, or has 8 ounces, then you're anywhere from 8 to 20 years up to 15 to 30. The problem with the heroin is it's so fine to get these weight classes. It takes a tremendous amount, and we find that very difficult to find around here in one area, in one specific person. So those would be your punishments.
Mike, and I need the panelists, make sure you have the microphone so everyone can hear.
Okay.
Mike, one other question. If someone is addicted to heroin and arrested, what options do they have?
Well, they have several options. If they're arrested, chances are, and if it happens in the city, then they're automatically going to be screened and go into the drug treatment court program, which is run by Judge James Cecil out of City Court. If you're out in the county, town and village courts, they get handled differently depending on the judge. A lot of the judges will send them down for you to be screened for possible enrollment in the drug court. And if you succeed, your charge usually gets dismissed and you get your treatment that you need. If you fail, then they usually send you to jail, and they do graduated penalties where, if you don't show up or you miss treatment, they might put you in for a week or so. A lot of times, although it's counterintuitive, the best informants to allow us to get into the people who are selling drugs want to work with the police, and so we have to kind of watch out and make sure that while they're working with the police, they don't get their own heroin to use, or we don't encourage them to continue to use. And if they do that, we usually try to get them some kind of outside treatment so that they can assist in getting us search warrants. The chief mentioned today about the search up on Teal Ave. That started with a person who they arrested for possession 7th who decided to turn and become an informant, made a couple buys, we got the search warrant, and that's what they got. So it's counterintuitive sometimes. You need to use the addicts or the people that are using to get to the dealers, but you also have to try to get them treatment, and we also try to educate people prior to them getting addicted. So we try to use a 3-pronged approach.
I want to turn to Narcan. How much have you seen an increase in Narcan, both from EMS and from the police agencies? Jason, let me start with you.
Well, first off, Narcan by itself, our uses went up dramatically, and so has the price. It's almost like a supply and demand with the Narcan as well. Just to put in perspective, May of last year, for a 2-milligram vial of Narcan was costing us $14.50. As of today, the price is almost $50 for the same injection. So along with everything else, the added cost is there. Also, just to put in perspective as well, I want to share with you some stats here that I looked up. NAVAC ambulance covers an area of 64 square miles in the northern suburbs of Onondaga County. Last year in 2015, we responded and treated 6,642 patients. Out of those patients, we had 174 patients that were overdosed. For a small community, that's a huge number. 36 of those patients were found in full cardiac and respiratory arrest, which means that they were not breathing and nor did they have a heartbeat, and CPR was in progress when we got there by fire department. With the use of Narcan on those cases, the majority of them were able to survive. Unfortunately, some of them did not. That's 2.6% of all our calls in one area of the county. And if you look at all the other county EMS agencies that are out there, it's really shocking when you look into it. As far as the use of Narcan, now that many police departments, if not all police departments, carry Narcan, as well as the fire departments, it has made a tremendous change and for the better in helping people survive an overdose. Same time, it's kind of a double-edged sword. It's also kind of giving people a false sense of security. That if they overdose, they know that the police are going to show up, or the fire department or EMS. We're going to give them the Narcan, and they're going to wake up. So I think a big part of the education as well is what we try and do is after we give them the Narcan, we reverse the effects of the opiate. So we try and counsel them on how this doesn't work all the time. They got lucky this time. Next time they may not be so lucky.
Sheriff, do you want to, or the chief, do you want to jump in on the Narcan question at all? Or?
Well, we don't carry it because we have our fire department in rural metro. It's just seconds away, if not there before us in most cases. So the city of Syracuse, we don't carry it.
What, for the sheriff and the chief, innovative approaches that you're taking over the next part of this year and the years ahead for dealing with these issues? Sheriff?
Well, first of all, let me just say, obviously, I'm here representing law enforcement, and even though I have 40 years' experience, I'm here to acknowledge that law enforcement is not winning the war on illegal drugs. And so now that as I'm the sheriff, I'm also responsible for the Justice Center and people that are held at the Justice Center accused of crimes. A program that I announced support of yesterday is something that has come to my attention based on a presentation last fall, and also is being done most closely to here in Albany County. And it's a heroin treatment program that begins while a person is in custody. And the basis of that is obviously being in custody, they're in a controlled environment. And this allows for some counseling, and it also allows for this particular opiate blocker, is what I'm told is described as Vivitrol, is then based on the person being volunteering for this, would receive this injection, but then that is only one step of a plan. And that plan includes timing that with their release date and going into a very structured treatment program. And I like that for a number of reasons, but most importantly, we see people coming back into the Justice Center time and time again. They're obviously relapsing, and most times they're either committing a crime or being accused of a crime, coming back into the Justice Center. And for my deputies who are trying to do the best they can, most times they don't know when a person is coming through the doors of the Justice Center what problem they have, what they may be on, where they may be secreting still that drug on their body. And so it's just my feeling that a jail, because that's really what it is in the Justice Center, is not a place for withdrawal. Secondly, this is an opportunity for someone who wants to try to recover, to get them on a path that, again, starts in a structured, controlled environment, but has to continue on, obviously, with the help and support of many other organizations in our community. I went on record yesterday saying I support that. I support that as a sheriff. I support that, as a member of law enforcement. I support that as a member of this community who wants to do my part to try to get on top of what this truly is, and it's an epidemic in my view. We can prevent this, just as I sit before groups on Stop DWI night and talk about people who are driving while intoxicated. We can prevent that. We can prevent this from happening. The second part that I announced support of is what in one other police agency in Massachusetts has called it is an angel program. And this is being tried by other police agencies across the country in many different forms. But basically what it is it changes the attitude of law enforcement when we're meeting or coming across people in our community who have an addiction. And instead of just arresting them, because we know that is not going to solve the problem, we're acting more as one more resource to help assist them in getting treatment and getting into recovery. So tomorrow at our monthly county chiefs meeting, I'll be sharing this with my colleagues from the other agencies, and I'm quite sure that they will be supportive of us basically having a little different attitude when it comes to this situation, which is truly overwhelming us.
Do we have time for one question or no question? Okay. Gentlemen, thank you. I want to call up Monica Brown, who's the Executive Deputy Commissioner for the Department of Social Services and Economic Security for panel number 2. And please join me in thanking these gentlemen.
Chief, would you just talk about that little bit of your program? Just wanted to have that, make sure that you have this Dunkin' Donuts thing.
Okay, the first thing I want to say is I dare any of you to joke about police and donuts and Dunkin' Donuts. All right? Okay, so, all right, and now that I've thoroughly threatened you all, I'm gonna sit down real quick. Yeah, listen, we're all in this together, right? We can't, as the sheriff alluded to, we can't arrest our way out of the problem, and it is indeed a problem. And there are people out there that are poisoning the people of our community, that is our drug dealers. And so if the community works together with law enforcement, we can help to put an end to this problem. There are people out there with problems, and we need to steer them toward treatment. There are people out there who are criminals, and we need to steer them toward the jail. So with this, we partner with Dunkin' Donut. And these cards, there's 500 of them in the back of the room someplace. This points out to you how you could use the anonymous tips line to contact the city of Syracuse in the event that you see any type of crime. And as a bonus, you get to enjoy a free cup of coffee or tea, courtesy of Dunkin' Donuts.
Mike, one more thing. I think, Mike, you want to just mention something about tip 411?
Yeah, late December, Bill Fitzpatrick, along with other law enforcement agencies, and the chief started the one for the city. We also did one for the county, including the city. It's a TIPS 411 line. It's an app. There's flyers about how to do it. You can download it to your phone. You can call anonymously, and you can use it. I think there's flyers in the back for that as well to help you out. If not, you can call the office and we can get them to you. If you're a community organization, you can let us know how many. We'll send an investigator out to you, and you can pass them around your neighborhood. We need all the help we can to identify criminals, because obviously they do things quietly, so they hopefully will not get caught. So we need the public's help to identify where those people are. And if you do call in a tip, I'm just going to caution you, it'll take a little while for the police to do things, because they got to verify your tip and put together a good case, but we'll eventually get there and get the people who are selling and hopefully get them convicted and locked up. So thank you very much.
We wanted to just take a moment and share a couple of your questions. We do appreciate you responding by filling out the cards. Any cards that you give to us, I'll collect them, Michelle will collect them at the end. If you happen to have them at the end, we are going to share these in a couple of different forums. So just because we don't read them here, because we don't have time to read all the questions or comments, doesn't mean that we won't be including them, sharing them in future venues, online, etc. A couple of really compelling comments related to people coming in and out of jail, related to the panel that was just discussing, that was just sharing. One of you shared a very compelling story about your son in and out of jail, multiple, quote, slaps on the wrist, eventually doing some pretty serious time, 12 years. Another one of you asked the question, what happens when people get out of jail, when they're released from jail? Several of you made some comments related to that challenge. I don't know if anyone wants to respond to those questions. But this notion of cycling in and out of the system, and then ending up out of jail, and then returning, and what can we do to intervene at that point with folks? And if also we could get this portable mic live one for future panels. When we get to panels 2 and 3, again, write your questions down while folks are talking. I'll collect them. I'll be able to address a couple of them. Excuse me.
Just quickly to address the question, when people are released, despite the best efforts of, again, other organizations, whether it be probation and other service providers, unfortunately most people, when they're released, go right back to usually where they came from or where they live, and they go right back into the environment where they know they can purchase drugs, and sadly, within days, they're back using again. And this again is what I spoke to earlier about being supportive of a program where it's more structured, when people who again have an addiction and want to help themselves enlist themselves into this program, and I think it's certainly worthy of a trial basis. So.
Thank you, Sheriff. That was the one which we actually had discussion yesterday also, that it takes a village to have that all things addressed. And this is a process which we are trying to do together, from law enforcement, from providers, all together, to put it in context, to provide supports not only with the provider community, with the behavioral health, but also to go out in the community and do that. So this will be work in progress, and that's why this forum is trying to address that. This is just a beginning of conversation.